Добрый вечер.
Dear colleagues, dear members of the Dissertation Council, today is the 15th of January, 2021, 8 p.m. Moscow time. We're beginning the session for the Dissertation Council for the defense of the dissertation by Andrey Remezov. The topic of the dissertation is staged surgical treatment of purulent necrotic complications of diabetic foot syndrome. Specialty is 140117. Mr. Remezov, please take a seat. Under the order issued by St. Petersburg State University on the 10th of November 2020, I, Professor Sergei Varzin, Doctor of Medical Sciences, St. Petersburg State University, have been appointed the chairperson of the Dissertation Board. The other members of the Dissertation Council have been appointed by the same order. They are Professor Padre Sigua, Doctor of Medical Sciences, Mechnikov, Northwestern State Medical University. Professor Viktor Kashchenko, Doctor of Medical Sciences, St. Petersburg State University, has joined us via video conferencing system. Can you see us? Can you hear us? Yes, I can hear you and I can see you. Professor Alexander Andreev, Doctor of Medical Sciences, Voronezh State Medical University. He has also joined us via video conferencing system. Can you hear us and see us? Yes. Dr. David George Armstrong, Doctor of Philosophy, University of Southern California, the United States of America, is not attending this session for a good reason. Professor Vladimir Bensman, Doctor of Medical Sciences, Kuban State Medical University, is not attending this session either for a good reason. The degree applicant, Mr. Andrey Remezov, is here. His research advisor, Associate Professor, Canticle of Medical Sciences, Veronika Petrova, is also attending this session of the Dissertation Council. I would like to ask the members of the Dissertation Council who are attending the session via video conferencing to switch off their microphones. Please make sure that your microphone is switched on when you are given the floor. The session of the Dissertation Council is being recorded and broadcast on St. Petersburg State University website, and it is also being interpreted into English, from Russian into English, or from English into Russian. You can ask questions and make comments using the email address that you can find on the official website. The questions are supposed to be relevant to the contents of the dissertation. The technical personnel will refer the questions to me, and I will read them out during the discussion. The questions, as I have already mentioned, are supposed to be relevant to the contents of the dissertation. The authors of the questions are to write down their name, position, and workplace. The questions that are not relevant to the dissertation or to the presentation will not be read out. Under the relevant order, on the procedure of granting academic degrees at St. Petersburg State University issued by St. Petersburg State University. The session of the Dissertation Council is duly constituted, provided at least 2/3 of the members of the Dissertation Council are present. However, the total number is not to be fewer than 4 people. This Dissertation Council consists of 6 people, 4 of which are present, including 2 members of the Dissertation Council who are participating in the session via a video conferencing system. Therefore, we have a quorum. The agenda is as follows. The time limit is about 2 hours. Number 1, the chairman's presentation about the documents submitted by the degree applicant and their conformity with the requirements. The chairman's reply to the questions, if any. The presentation given by the academic degree applicant to provide an overview and findings of the research, about 15 minutes. Questions to the academic degree applicant about the presentation. No more than 2 minutes for each question. Then, reports on the dissertation. The council members will be taking the floor in turns in order to read out their reports. About 10 minutes for each member of the Dissertation Council. Next, the chairman's report on the dissertation. Comments about the critical remarks and questions. Open discussion. The floor will be given to the members of the audience. They can give a brief account of their ideas or ask questions about the research. No more than 5 minutes per person. However, it is necessary to fill in the registration form and give their full name before the talk.
Будет осуществлено также представление председателем вопросов в адрес соискателя, пришедших в порядке обсуждения его выступления.
The chairperson will read out the questions that have been received via email. And the degree applicant will have a chance to answer these questions, if any. The next item on the agenda is the presentation of the research advisor. Next, deliberations of the member of the Dissertation Council before an open balloting on conferring or non-conferring the academic degree. The discussion of the results of the defense procedure is not broadcast. Next, open balloting, vote counting, and recording the results in the minutes. Making a decision on whether to confer or not to confer the academic degree. And a closing speech by the degree applicant, no more than 2 minutes. Before proceeding with the agenda, I would like to ask you if you have any questions or objections to this agenda. There are no questions or objections. Now, let's proceed with our agenda. I would like to ask you to switch off your mobile phones so that we are not disturbed during the session. The members of the Dissertation Council who are attending the session via video conferencing system, please do not switch off your mobile phones. You might need them if we have some technical issues. Now I will proceed with the agenda. We will start with my presentation.
Диссертация Ремезова Андрея Владимировича
The dissertation by Dr. Andrey Remezov is submitted in conformity for the degree of the Doctor of Medical Sciences. The topic of the dissertation is staged surgical treatment of purulent necrotic complications of diabetic foot syndrome. The dissertation was approved for the defense by the order of the Academic Secretary of St. Petersburg State University. Dr. Andrey Remezov completed his dissertation in St. Petersburg State University. The research advisor is Associate Professor, Candidate of Medical Sciences, Veronika Petrova. The academic degree applicant has published 4 research papers. He has also published 3 papers in peer-reviewed journals recommended by the Ministry of Education and Science. 1 paper has been published in the Web of Science and Scopus journals. The degree applicant has submitted a full set of documents to the Academic Secretary of St. Petersburg State University. The documents are in compliance with Section 3 of the order. The documents are stored in the dossier. The representative of the Department for Dissertation Council Management has the copies of the documents. Before giving the floor to the academic degree seeker, I would like to ask the members of the Dissertation Council if they have any questions, and if it is necessary to read out the list of documents.
Вопросов нет.
There are no questions. Dr. Remezov, the floor is yours. Members of the Dissertation Council, Mr. Chairman, the topic of my dissertation is staged surgical treatment of purulent necrotic complications of diabetic foot syndrome. Please speak into the microphone. Diabetic foot syndrome is characterized by pathological changes in the peripheral nervous system, arterial and microcirculatory system, bones and cartilages of the foot. The condition may lead to foot ulcers and gangrene. On this slide, you can see that the number of diabetic patients has increased, and over the past 20 years, the number of diabetic patients has trebled. About 34% of patients with diabetes develop diabetic foot syndrome. The prevalence of diabetic foot ulcers in England is about 6%, and it is even bigger in some other countries. Every year, 26 million new cases of diabetic ulcers are reported. About 50% of diabetic ulcers become infected. Moderate and severe infections may result in amputation. The 5-year survival after the amputation does not exceed 30%. And the lifespan of people with a diabetic foot syndrome is twice as short, in contrast to patients without a diabetic foot. So I have formulated the following overall goal of the dissertation. It is to improve the results of surgical treatment of patients with purulent necrotic complications of diabetic foot syndrome due to an improved treatment algorithm. The study objectives are as follows: to evaluate the outcomes of the complex surgical treatment of patients with purulent necrotic complications, to analyze the causes leading to adverse outcomes, to optimize the treatment algorithm, and to compare the outcomes of different types of surgical treatment. The patients were divided into two groups. All in all, 175 patients took part in the study. I came up with this particular number, 175 people, after some preliminary estimates. The research was done in the university clinic. The patients underwent a thorough examination, including general examination, laboratory tests, and investigations. The patients received non-surgical treatment as well: blood glucose lowering treatment, antibacterial therapy, urotropic treatment, angiotropic treatment, and antiplatelet therapy. The wounds were treated with the most advanced wound coatings, and wound dressings. The patients also had a chance to have a consultation with a specialty doctor. The slide shows a comparative analysis of both groups. The patients in the study group had a more severe progression of the disease, and they sought medical attention more often. The analysis of outcomes in the control group showed that the overall rate of high-level amputations is 13%. The average hospitalization time in the control group was about a month. I would like to emphasize that diabetic foot syndrome is a multifocal pathology, not only surgical infection. We were able to identify the so-called situational strategy. If the patient had phlegmon, then the wound was opened and drained. If the patient had necrosis or gangrene, then he underwent amputation. Sometimes surgeries were performed in cooperation with vascular surgeons. 18 out of 20 patients had a favorable progression after the surgery. After the preliminary estimates, I was able to formulate the following statements to be defended. The best results were in patients that had their blood flow preserved. Revascularization surgeries allowed us to improve the outcomes of surgical treatment. Most patients were able to undergo reconstructive operation during one hospitalization. So we developed a treatment algorithm. The patients were treated by a team of specialists. Patients with diabetic foot syndrome must be dealt with on a case-by-case basis. Therefore, we included even an anesthesiologist into the team of doctors. Here you can see the treatment algorithm in the study group. 80% of the patients were able to have all the necessary surgeries during one hospitalization. About 50% of the patients had angioplasty. vascular surgeries were performed according to the angiosome concept. Balloon angioplasty was performed if there was an occlusion of the femoral artery or an occlusion of the tibial arteries. If there was a subocclusion of the popliteal artery, the patients also had a balloon angioplasty. When performing a foot amputation, the Ulcers modification of sharp amputation surgery was used. The presence of blood flow in the plantar arterial arch was taken into account. Therefore, in contrast to the traditional surgical method, at first we carefully separated the flaps with a single area of tissues. The next step was to cross-cut each bone separately by a wire saw. As the final stage of the surgical method, necrectomy was performed for the back and plantar flap down to the viable tissues. Non-focal osteosynthesis devices were used in the case of osteomyelitis in the midfoot. This allowed to conduct osteonecrosequestrectomy of metatarsal bones and to unload the foot. Xenografts and dermal equivalents were used to close the wound on the plantar area. Here you can see orthopedic reconstruction, and here you can see reconstructive surgery of soft tissues with a flap or with a dermal equivalent. The patient had orthopedic correction as well in order to unload the foot. Here you can see hospitalization times in both groups. About 65% of the patients had at least two surgeries during this time. Here you can see that the overall rate of high-level amputations decreased threefold. Here you can see the main research findings. They are: diabetic foot syndrome may lead to amputation, namely high-level amputation. One of the main reasons for high-level amputation is the fact that it is impossible to restore blood flow in the foot. Comprehensive surgical treatment requires revascularization of the foot. The algorithm treatment allowed us to decrease the number of high-level amputations and to decrease hospitalization times as well. Thank you. Thank you very much for your presentation. Do the members of the Dissertation Council have questions to Dr. Remezov? Dr. Remezov, dear colleagues, dear members of the Dissertation Council, I would like to say that I'm really glad to be here now. I defended my own dissertation in this university, so it's like a holiday for me. I have several questions to Mr. Remezov. I have a few general questions. Do you know why it happened so that the number of patients with diabetic foot syndrome in England is lower? It was a screening study and it was found out by chance. This information does not reflect the overall situation. Probably this sampling wasn't the right. this study showed that a specific group of patients had this amount of. So this sampling does not reflect the situation in the population. What's your attitude to dermal equivalence? Do you believe that dermal equivalence can be used as alternative treatment? In how many cases did you use dermal equivalence? Yes, we use dermal equivalents. Usually we use them to close plantar ulcers. It is possible to use grafts, but the procedure is more complicated if the patient is suffering from diabetes and is immunodepressed. Because if we take a graft from this patient, then he will have another lesion, another wound. How many patients were in your study that received this type of treatment? In my study, 10 or 12 patients were given dermal equivalents, but now we use dermal equivalents on a regular basis. Do you grow dermal equivalents yourself? Or do you order them in laboratories? We have our own laboratory. We have a biologist on staff. So we grow our dermal equivalents in our own laboratory. I also have some other questions. Where did you conduct your research? In the university clinic. Why did you use Wagner Classification, whereas there are other classifications? When I started working in the university clinic, the Wagner Classification was well established, so our colleagues and myself used this classification. Does this classification have any drawbacks in comparison with more modern classifications? Modern classifications take into account different other aspects, and they are more important for making forecasts about the outcome. I would like to ask your appearance. What contribution does endovascular surgery make into the treatment of such patients? Does it make an important contribution into their treatment? Vascular reconstruction, including endovascular surgeries, make an important contribution into the treatment. Thank you very much. I'm absolutely satisfied with your answers. I have a question to the member of the Dissertation Council. I have a question to Dr. Andreev. I would like to thank you for including me into the Dissertation Council. I'm always happy to visit St. Petersburg. It's unfortunate that I'm not able to be in St. Petersburg now because I have my favorite places there. So now I will move on to my questions. the degree applicant does not use autoplasma in his research. As far as I know, it can be used very efficiently. Why is it so? Well, I would say I did not have an opportunity to use the autoplasm. I would like to ask you about long-term results. What about the recurrences? Were they often in patients with diabetic foot syndrome? I'm interested in ulcers and I'm interested in the results of endovascular surgeries. When it comes to long-term results, they are as follows. The recurrence of ulcers was about 2.3 years after the surgery, or rather after the healing. As for vascular reconstruction, recurrences occurred in about 18 months. But non-surgical treatment was quite effective as well for such patients. So this vascular defect did not lead to new ulceration. And restenosis occurred in about 90% of the patients, and they had a revision surgery, namely balloon angioplasty, after 2 years. So I can see that about 2.5 years later, they had restenosis. I'm also interested in the economic aspect, since it is also of importance. Did you make any estimates from the economic point of view? I was more interested in long-term results, namely in the decrease of death rate. As for the economic aspect, it was quite difficult to make such calculations. The medical coverage was enough to treat these patients, and hospitalization cost about 120,000 rubles. Revascularization, foot amputation and hospitalization expensive coronary balloons cost about the same. So in both groups, the cost of the treatment was about the same. And my last question. You said that the study group included patients with a more severe progression of the disease. I would like to ask how you performed randomization. The patients that were rushed to hospital were included in the control group. And the patients that were referred to us by other surgeons were included in the study group. Therefore, we had a situation when the patients with the more severe syndrome were included in the study group. Thank you very much for your questions. I would like to ask Professor Kashenko if he has any questions to Mr. Remezov. Dear members of the Dissertation Council, dear colleagues, I have a couple of questions. I would like to start by the main question that I have. I believe that the answer to this question is really important. I would like Dr. Remezov to formulate the novelty of the study. It might seem to somebody that we are discussing here obvious things. For example, the second provision to be defended. It seems obvious. No other comment is necessary here. You cannot get better results if the blood flow is not restored. So, please, what makes your research different from other research works in terms of its novelty? The novelty of the research is as follows. My dissertation summarizes my 10-year research. I have been developing the treatment algorithm for 10 years. And diabetic foot syndrome is not only about surgical infections. In many cases, patients are treated by surgeons. However, vascular surgeons are not included in the team of doctors. When the ulcer is healed, they are sometimes recommended to have revascularization surgery, and my dissertation shows that several surgeries must be performed during one hospitalization. And this approach improves long-term results and long-term outcomes. The treatment algorithm was first used in about 2008, and I have been using this treatment for about 10 years. This treatment is in line with other clinical guidelines. However, it is different from what we see, for example, in classical textbooks on surgery. Are you satisfied with the answers of the degree applicant? I also have some questions. I would like to ask you about balloon angioplasty. What types of balloon angioplasty did you use? At what level? How many vessels were involved, and so on? Could you please talk in more detail about it? This might be interesting for angiosurgeons, for example. Revascularization surgeries were performed many times. I used open revascularization surgeries, balloon angioplasty, thrombectomy of the femoral artery, and so on. When it comes to the levels of balloon angioplasty, I would like to say that everything depended on the angiosome concept. So when we performed these surgeries, angiosome concept was taken into account. The entry was done through femoral artery. Since it's technically difficult to make entry through foot arteries, and the risk is also higher. How many vessels were opened? We involved the vessels that participated in the blood flow to the foot. Balloon angioplasty involves the risk of dissection that might block blood supply to other arteries. So each patient was treated on a case-by-case basis. I cannot give you a universal recipe here, but the main principle was the angiosome concept. And the arteries were chosen according to the part of the foot that had lesions. Yes, I'm satisfied with the answers. I have some other questions as well. You talk about neuropathic form of diabetic foot. Why did you include these patients in the study? We know that such patients do not require revascularization. Here we are talking about staged surgical treatment. So my dissertation is not about revascularization only. Patients with neuropathic problems also have lesions in the bones and cartilages. In this case, they need orthopedic correction. So we used multidisciplinary approach in my dissertation and included different specialty doctors in our team. Do you have any other questions to the degree applicant? No? That's all for now. Are you satisfied with the answers? Yes, I'm satisfied with the answers. Now, the next item on the agenda is the report on the dissertation. There are no external reports on the dissertation. Now, I give the floor to Professor Sigua. So, report on the dissertation by Dr. Andrey Remezov, submitted in conformity for the degree of the candidate of medical sciences. I'm not going to talk at length about diabetes. And I believe that diabetes is an important issue. Dr. Remezov talked about statistics, so up to 8% of the population suffer from diabetes. The dissertation uses modern methods of treatment of diabetic foot syndrome. I would like also to emphasize that the dissertation summarizes 10-year work performed by the degree applicant. Moreover, the author of the dissertation uses a multidisciplinary approach. I would like to emphasize the following thing. I would like to emphasize the novelty. The methods that are discussed in the dissertation are not new. However, what is new about the dissertation is the order of using these methods and technologies, and moreover, the candidate for the degree organized a team of doctors to treat the patients. There are many dissertations that describe specific methods of treatment, but this dissertation includes different aspects of treatment, and I believe this is the main novelty of the thesis. This approach has been used since 2008, and the dissertation is defended only today. So the dissertation describes the treatment algorithm of patients with diabetic foot syndrome. The use of this treatment algorithm allows to decrease the number of high-level amputations, which proves the efficacy of the treatment algorithm. Moreover, the treatment algorithm is in line with existing clinical guidelines. The dissertation shows how to improve surgical outcomes and adverse outcomes. Namely, it shows how to avoid amputation. The research findings show how treatment can be effective. So the dissertation has enough data, has enough tables, photos and pictures, and it is well written. The data and research findings are valid and credible. So the dissertation by Dr. Andrey Remezov, Staged Surgical Treatment of Purulent Necrotic Complications of Diabetic Foot Syndrome, complies with the major requirements set forth in order number 6821/1 as of the 1st of September 2016 on the procedure of granting academic degrees at St. Petersburg State University, and Dr. Remezov can be awarded the academic degree of the of the candidate of medical sciences. The specialty is surgery. The dissertation is compliant with section 11 of the above-mentioned order. Thank you very much. As far as I know, as far as I see, there were no questions in the report. Thank you very much for reading my dissertation. and thank you for your report. Now I give the floor to Professor Alexander Andreev. Diabetic mellitus is a global medical challenge. It is also a social challenge. About 6% and even up to 20% of the population suffer from diabetes. Up to 30% of them develop diabetic foot syndrome. Many patients undergo amputations. So I believe that the overall goal of the dissertation is relevant. Namely, the goal of the dissertation is to improve the treatment algorithm of patients with diabetic foot syndrome. The degree applicant has developed a treatment algorithm. You could have received a patent for this algorithm, I think. This algorithm is unique and it has its own specifics. So I believe you could have received a patent for your treatment algorithm. The research also has novelty. It summarizes 10-year research. It was done in St. Petersburg State University. Moreover, Mr. Remezov also formulated indications for surgeries. The dissertation is relevant for practical use and for theory as well. The research findings are valid and credible. He included 175 patients in the study. The methods of the dissertation and diagnostic methods used for treating the patients are relevant and advanced. Dr. Remezov also made presentations of his research findings at a number of conferences. He has also published 11 papers. 4 of them have been published in journals recommended by the Ministry of Education and Science. The structure of the dissertation is traditional. It consists of 3 chapters: introduction, conclusions, and practical guidelines. The reference list is quite long. However, there are only 43 items or 43 papers that were published in English. But for this particular dissertation, this is not a problem, because it contains quite a lot of papers. The reference list contains quite a lot of papers published in Russian. I believe that the approach presented in the dissertation is very interesting. I would like you to talk in more detail about the algorithm. So I think you should write practical guidelines that can be used for clinical practice. I do not have any critical recommendations about the dissertation. The dissertation by Andrey Remezov, Staged Surgical Treatment of Purulent Necrotic Complications of Diabetic Foot Syndrome, complies with the major requirements set forth in Order on the Procedure of Granting Academic Degrees at St. Petersburg State University, and Dr. Andrey Remezov can be awarded the academic degree of the candidate of medical sciences in surgery. The dissertation is compliant with Section 11 of the above-mentioned order, and I will be voting in favor of conferring the academic degree. Thank you very much for your report. Thank you very much for your report. I will follow your advice and I will develop practical guidelines. Thank you very much for your recommendation. Now the floor is given to Dr. Viktor Kashenko. Dear members of the Dissertation Council, I believe that the dissertation, the topic of the dissertation is relevant. We have a technical issue here. We have a technical break now. The technical break is over. Sorry. Dear members of the Dissertation Board, I would like to say that my role as a member of the Dissertation Council has become easier since my colleagues have already read out their reports. I would like to focus on the questions that have not been answered yet. When it comes to the relevance of the topic, I would like to emphasize that the dissertation is really up to date. Many of us are attending the session online because many of us work in the red zone in hospitals because of the pandemic. This is a challenge to the medical community. But diabetes mellitus is a comorbidity that decreases the chance of survival for COVID-19 patients. And today we are talking about ways to minimize the complications of diabetes. Therefore, the dissertation cannot be overestimated. I believe the research findings may save lives of our patients. I would like also to emphasize that the dissertation summarizes the 10-year experience. The dissertation was done in Pirogov clinic, and this is one of the best clinics in Russia. One of the priorities of Pirogov clinic is endocrinology. Today we are talking about treating diabetes and its complications. And endocrinology is part of treating such patients. Diabetes mellitus is closely connected with endocrine dysfunctions. Therefore, it is very important to use a team of doctors in order to treat patients with diabetes. This multidisciplinary approach is extremely important and significant. Multidisciplinary approach allows us to use non-invasive therapies or therapies with low level of invasion. I believe that Mr. Remezov's dissertation shows that Pirogov Clinic is one of the centers of excellence. I would like to emphasize again that a team of workers, or rather a team of doctors, is necessary to treat patients with diabetes. And this is one of the strong points of the dissertation. It was very important for me to talk about the novelty and the theoretical and practical significance of the dissertation, and we have talked at length about these aspects today. I do not have any specific critical remarks. The dissertation has some spelling mistakes and some stylistic mistakes. I'm afraid the translation is not perfect, but this is a universal problem. However, the English version is quite readable. But still, I think that we should integrate into the international community. I have already asked the question that is written in my report. I asked him about different types of balloon angioplasty. Now, I would like to say the following. The dissertation by Dr. Remezov, Staged Surgical Treatment of Purulent Necrotic Complications of Diabetic Foot Syndrome, submitted in conformity for the degree of the candidate of medical science in surgery, is an independent research work. It provides a solution to an important issue. And the dissertation complies with the major requirements set forth in Order 6821/1 on the procedure of granting academic degrees at St. Petersburg State University. Dr. Andrey Remezov can be awarded the academic degree of the candidate of medical sciences in surgery. Thank you. Thank you very much for your report. Would you like to say anything? Thank you very much for your report and for your critical remarks, and I agree with your remark about the English language. There are two reports left. One of them was written by Dr. David George Armstrong and by Professor Vladimir Bensman. These are the members of the Dissertation Council that are absent for a good reason. And I will read out their reports. Report by David George Armstrong. I will be reading out the translation into Russian. Dear colleagues, I had the pleasure of reading Dr. Remezov's thesis. It consists of an introduction and 3 chapters, in addition to a conclusion and practical recommendations. And I will review it in order. Introduction. The introduction is logically presented. Enthusiasm for it would be increased if the candidate would consider updating the citations. In fact, most of the citations are more than a decade out of date. This is particularly true for estimations of diabetes prevalence, which are more than twice than the candidate mentions. I would direct him to the International Diabetes Federation World Diabetes Atlas. Additionally, the candidate might consider updating much of the estimates on the prevalence and significance of diabetic foot complications. A technical review may be found here, and Professor gives a reference. Chapter 1, Literature Review. The first sentence has a very minor issue. The Nobel Prize is actually the Nobel Prize in Physiology or Medicine, not Nobel Peace Prize in Medicine. The discussion of various classification systems is tantalizing, but I believe needs just a bit more development. Why select the Wagner system when it is, amongst all systems, the least predictive of poor outcome? Why have many surgeons considered adopting a threatened limb classification that marries podiatric and vascular surgical components rather than just a wood classification system? Chapter 3, Clinical Study. Reporting patient groups based on Wagner grades is rather distracting and potentially reduces the potential descriptive impact of these data. Essentially, the candidate is creating a less specific version of the UT wound classification system. The candidate included 100 subjects in the active and 75 in the control. Was there some power calculation that led to this? The description of surgical decision-making is particularly thoughtful. Getting back to the Wagner grades. Wagner grades is rather distracting and potentially reduces the potential descriptive impact of these data. Essentially, the candidate is creating a less specific version of the UT wound classification system by adding infection to the wound depth. Furthermore, table 16 is harder to decipher as well. Were there really no patients without osteomyelitis that didn't receive an angioplasty? Scheme 3 is particularly helpful and descriptive. The comparison of the active and standard therapies is compelling. It could be made even more compelling if a comparison of both groups by Wi-Fi score was made. That could be visually quite impressive. Conclusion. This section is particularly strength of the thesis. It is laid out practically and points out to very real change made by the candidate as surgeon scientist. The candidate might consider specifying what types of skill sets would be ideal to carry out and to replicate the surgical service. The candidate might be directed towards Fitzgerald and co-workers, Wukich et al. And Miller et al. In summary, the independently conducted research by Dr. Remezov is both novel and a worthy addition to the literature. It meets the requirements established by the university for awarding the degree to which he has applied. Respectfully, Dr. David Armstrong. Dr. Remezov, please answer the questions. I will start with the first question about the Nobel Peace Prize in Medicine. That's spelling, and I'm afraid I omitted this mistake. I didn't notice it when I was reading it. As for Wagner Classification, we used it because it was commonly used in the clinic where the research was studied, was done. After reading the report, I made some new estimates, but it is quite tricky because the medical history of many patients are still in the archive. So, sometime later, we made some changes, and technically we used UT wound classification system, but the Wagner system was quite common in the clinic where I work. As for the remarks about the statistics, I showed new statistical data during my presentation, and I would like to thank Professor Armstrong for his questions. Thank you for your answers. I hope Professor Armstrong is listening to us and is satisfied with your answers. Now I'm going to read out the report by Professor Bensman. I will read out his report. All the reports are posted on the official website of St. Petersburg State University, so I will read out only the most critical parts of the report. Professor Bensman writes in his report that the research outcomes can be used in clinical practice of surgery hospitals that treat patients with the diabetic foot syndrome. The research findings can also be used for teaching at different universities. He also has some critical remarks about the dissertation. The dissertation by Remezov is a serious research work. It has many facts and many data. It also describes a new treatment algorithm. However, I have some critical remarks about the dissertation. I believe the critical remarks will provide some new insights. Moreover, the dissertation has some debatable issues, but they do not change the overall positive assessment. There is no universally accepted classification of the complications of diabetic foot syndrome. However, the degree applicant does not use universally accepted terms. He talks about neuroischemic, neuropathic, neuroosteoarthropathic forms. He even talks about mixed forms of diabetic foot syndrome. I believe these terms are not universally accepted. Diabetic neuroosteoarthropathy is not common. It accounts for about 10%. Moreover, it includes dystrophy and fragmentation of cartilages and bones in the mid part of the foot, which does not happen in patients with neuropathic form of diabetic foot syndrome. The dissertation does not make reference to some really significant research papers, namely works by Professor Davidov, Professor Larichev, Professor Kuzmin, and so on. On page 43, in table 9, There is a spelling mistake, I believe.
Ну, тут он говорит, что нужно, это не принципиальное положение, там
You should have used capital N here. On page 50, the author describes a strategy which is designed to save lower extremities. However, this strategy is not in line with the active surgical strategy in purulent surgery developed by doctors Kostyuchenko and Kuzin. Medical and social significance of high-level amputations of thigh and lower leg are not differentiated, and I cannot agree with this approach. Table 12, Table 14, and Table 20. In conclusion, I would like to say that the dissertation by Dr. Andrey Remezov, Staged Surgical Treatment of Purulent Necrotic Complications of Diabetic Foot Syndrome, submitted in conformity for the degree of Candidate of Medical Sciences in Surgery, is an independent research work. It was done under the supervision of the Candidate of Medical Sciences, Dr. Veronika Petrova. The dissertation provides a solution to a very significant medical and social issue. The goal of the dissertation is to improve immediate and long-term results of surgical treatment of patients with complicated forms of diabetic foot syndrome. The dissertation describes staged surgical treatment, and priority is given to revascularization of patients with neuroischemic and ischemic forms of diabetic foot syndrome. The dissertation is relevant, novel, and it has practical and theoretical significance. Therefore, the dissertation by Dr. Andrey Remezov complies with the major requirements set forth in Order 6821 on the procedure of granting academic degrees at St. Petersburg State University. According to the above-mentioned order, Dr. Andrey Remezov can be awarded the academic degree of the Candidate of Medical Sciences in Surgery, Specialty 140117. The dissertation is compliant with Section 11 of the above-mentioned order. Dr. Remezov, please answer the questions. I will ask with the last question about non-differentiating patients with different types of amputation. I did not divide these patients into different groups. Patients with amputated foot require less rehabilitation efforts than patients with amputations at the level of thigh or at the level of lower leg. I believe that these patients different from those that have amputated foot. So I don't think that we should differentiate between patients with amputations at the level of the thigh and at the level of the lower leg, because it is quite difficult to rehabilitate these patients. The member of the Dissertation Council also asked a question about some papers which are not cited in my dissertation. I believe that the approach presented in those papers is not relevant to my research work, therefore I do not cite them. As for the other research papers, I believe that they were relevant for treating with negative pressure, but the methods that are used in our clinic are different. We use Lohmann-Rausch methods. Therefore, I did not cite those authors in my dissertation. When it comes to the classification, I would like to say that the classification I used is widely discussed in Russian theoretical works, namely in the classical monography published by Professor Gazetov. And I accept the other critical remarks. Thank you. Thank you very much. Now I will read out my report. My task is quite easy because the other reports have been read out. I would like to express my opinion on some aspects of the dissertation. For example, there were some questions about Wagner classification, although there are modern classifications that have more grades or more indicators. I can talk from my own experience. Different methods can be used for long-term observation. However, when you want to improve your dissertation, you often change the overall method. Sometime later, you try to get an overall picture, and it turns out that it is impossible due to the fact that indicators were changed at different stages of the research. The indicators were different for each stage of the research. In this case, you cannot review the data that you have, and you cannot present an overall picture of the pathology. Dr. Remezov started his work more than 10 years ago. So I believe that the use of Wagner classification is justified here. Dr. Remezov was able to analyze the data that he has. We know that 3 years is the best time to write a dissertation. Some years ago, the PhD student was supposed to complete the dissertation in 3 or 4 years. But situations are different. And today I'm really happy that Dr. Remezov finally completed his dissertation. He was able to make a presentation here and discuss it at our Dissertation Council. The dissertation consists of 3 chapters. One of the chapters is devoted to literature review. In this chapter, Dr. Remezov analyzes the existing research papers. And I would like to say that I'm happy that the members of the Dissertation Council talked about some drawbacks of the dissertation that should be taken into account. Dr. Remezov included in his study 175 patients. The dissertation is well written. It provides a copious analysis of the data and of the methods of study. He uses a variety of methods in his dissertation, for example, X-ray studies, angiography, surgical methods, and so on. I would like to emphasize that the 3rd chapter of the dissertation is relevant and credible. We know a lot about treating diabetic patients, but sometimes we lack order and we lack something in treating our patients. And we shouldn't forget about the economic component here. This dissertation provides a very clear overall picture. Dr. Remezov is really enthusiastic about his work. He really wants to help his patients. His approach allowed him to develop a new algorithm for managing patients with diabetic foot syndrome. One of the members of the Dissertation Council even suggested receiving a patent for this treatment. I have WHO statistics. In 1983, there were 50 diabetic patients in the world. In 1996, there were 120 million diabetic patients, and in 2025, this number will reach 25,000 million patients. Diabetes mellitus is common in our country as well, since genetic and social and economic factors contribute to the development of this disease. Social and economic factors account for about 50% of all cases. Moreover, we all know that the number of diabetic patients has been increasing over the past 30 years in our country. The death rate is also quite high. The death rate has been increasing recently. In 2020, the death rate was quite high, was even record high. So I believe that progression of diabetes mellitus might become more complicated. The rate of complications will also increase, and diabetic complications will become more common. So I believe practical guidelines presented in the dissertation by Dr. Remezov are really significant and really important. Such practical guidelines are important for our healthcare. The dissertation has some schemes and photos and pictures. We are having technical break number 1 for some time.
Уважаемые коллеги, технический перерыв номер 1 завершен.
The technical break is over. Let's continue. So, the dissertation by Dr. Remezov, Staged Surgical Treatment of Purulent Necrotic Complications of Diabetic Foot Syndrome, complies with the major requirements set forth in Order 6821/1 as of the 1st of September 2016 on the procedure of granting academic degrees at St. Petersburg State University. Dr. Remezov can be awarded the academic degree of the Doctor of Medical Sciences in surgery. The dissertation complies with Section 11 of the above-mentioned order. Would you like to say something, Dr. Remezov? I would like to thank you for your report. Dear members of the Dissertation Council, are you satisfied with Dr. Remezov's answers to the critical remarks? Dr. Sigor, yes. Dr. Kashenko, yes. Dr. Andrey, yes, I'm satisfied. I'm also satisfied with his replies. Does anyone want to make a presentation? The floor is given to Professor Natalia Bubnova, Professor of the Department of General Surgery of the First Medical University of St. Petersburg. Thank you very much. I will not be speaking for more than 2 minutes. Dear members of the Dissertation Board, dear Dr. Remezov, I am a surgeon myself. About a year ago, we opened a department which treats patients with diabetic foot syndrome and which includes vascular surgery. And Dr. Remezov emphasized that vascular surgery is important for treating patients with diabetic foot syndrome. I would like to say that I liked the presentation. Dr. Remezov used to be my student, and I'm happy that he has made such a wonderful presentation today. Of course, some questions arise. I had a question which was similar to Dr. Bensman's questions. But you have since you have already answered this question, I would like to ask you another one. This study group had more foot amputations than the control group. How can you explain this? Thank you very much for your question. The number of patients with foot amputations was higher, but the number of severe forms of diabetic foot syndrome in the study group was also bigger. So if we compare in terms of the percent, then we have the following picture. The control group had a bigger amount of foot amputations. So this is due to the fact that the number of severe cases of diabetic foot syndrome in the study group was bigger. Thank you. We have received some questions via email. Could I ask you to read out the questions? The question is from Dr. Violetta Habibudovna. I will ask you about the methods and about the design. If it's a cohort study, then what kind of it in terms of being retrospective or being prospective? If it's not a cohort study, then what type of design did you use? Could you make a pause here? This is still the first question. Please write down the questions. Well, I can see them. When did the study begin and when did it finish? How were the patients divided between the two groups? How many patients were lost during the study? Can I answer the question? Do you understand the question? It's a cohort study. It's a prospective study. We started our study in 2008 and 2009. Since the end of 2009, we have been collecting the first group, and the study group was followed up later. When it comes to the number of loss of follow-up, I can say that they were not included in the study. 175 patients were followed until the end of the study. They came up for follow-up and for checkups regularly. I believe that is all. Next, I would like to ask you about your statistics. I have a question here. Why did you use methods of statistical comparison between the two groups? Why did not you use specific methods that are employed for cohort studies? It's difficult to use other methods other statistical methods, because the group of patients is really heterogeneous. So it turns out that we have patients with amputated foot and patients with other procedures. So technically these are two different patients. But we could not use other statistical methods. Technically it was impossible to have a sampling of about 1,000 patients in order to use other statistical methods. Question number 3. I would like to ask you about the practical recommendations. You speak about the multidisciplinary approach. What types of specialty doctors were included in the team? Were there endocrinologists? Was it an in-hospital pair or out-hospital pair? You talk about compliance to treatment in your dissertation, talk about motivating patients. Who motivated patients to comply with their treatment? I will start with the last question. I myself and my research advisor worked with the patients personally. They were motivated to comply with the treatment because they wanted us to be their main doctors. So that's why it was important for me to talk to the patients myself. As for the multidisciplinary approach, I believe that all the doctors were included on the slide. They were doctors from the Pirogov clinic, and I would like to thank my colleagues. They are responsible for these patients. For example, it's easier for a vascular surgeon to say that there is no indication for vascular surgery, but they didn't do so. For example, when it comes to anesthesiologists, it's easier for them to give some general anesthesia, but the patients were dealt with on a case-by-case basis. Are there any new questions? We have another question. I have read out all the questions. There are no more questions. Now the floor is given to Dr. Veronika Petrova, the research advisor. Please talk about Dr. Remezov and about his work. I will be brief. Dear members of the Dissertation Council and dear colleagues, I would like to thank you for your work. and I would like to thank Dr. Remezov for completing his long-term work. I'm happy that finally the dissertation is completed. Dr. Remezov graduated from the Medical School of St. Petersburg State University. He became interested in surgery at the very beginning of his studies. He was the chairman of the students' research group on surgery. He also helped me in Sofia Perovskaya Hospital. He provided his assistance to me during my shifts. He is one of the most intelligent students I have ever met. So I would like to say that I'm really happy with his presentation. I like the way he answered the questions. We have been working together for more than 10 years and we are still cooperating. I hope he will complete a dissertation for the doctoral degree sometime in the future. Dear members of the Dissertation Council, dear colleagues, some members of the Dissertation Council are attending this session online. Do you have any questions about the online regime of our session? If you have any questions, please answer them, please ask them. There are no questions. Dear colleagues, we have an opportunity to have a break in order to discuss the results. We can switch off the broadcast. Do you think it is necessary for us to have this break, or can we proceed with the voting right now?
Кажется, учитывая поздний час, мы можем обойтись.
Since it is quite late, I don't think we need a break.
Я бы сказал, что поздний час, он для нас не является препятствием.
I believe that late hours is not an obstacle here. I believe other issues are important here.
Можем приступить к открытому голосованию? Или нужно сделать перерыв технически для обсуждения?
Can we proceed with the voting, or do we need a break? I don't think we need a break. Dr. Andreev, the same question. I don't think that we need a technical break. So, we will proceed with the voting. We are beginning the open voting on the issue of conferring the academic degree to Dr. Remezov, specialization 140117 surgery. Let me remind you that the decision of the Dissertation Council on conferring the academic degree is positive, provided more than 50% of the Council members voted in favor. In our case, 3 people is more than 50%. This is in conformity with Section 23 of the Order. I will be asking each member of the Dissertation Board in turn. Dr. Andreev, how do you vote? I think we should confer the academic degree to Dr. Remezov. I vote in favor.
Член Совета Кащенко Виктор
Dr.
Анатольевич.
Kashenka, how do you vote?
Я голосую за.
I vote in favor.
Член Совета Сигур Андрей Валерьевич.
Dr. Sigo, how do you vote? I vote in favor.
И я, председатель Совета
I,
Сергей
Dr.
Александрович,
Varzin, the chairperson of the dissertation board, also vote in favor of conferring the academic degree.
Таким образом, уважаемые коллеги,
So,
члены,
dear members of the Dissertation Council, dear guests,
что из 4 участников
out of 4 members of the Dissertation Council,
Совета членов Совета проголосовали за
4 members have voted in favor of conferring the academic degrees. Nobody voted against and nobody abstained from voting.
о присуждении Ремезову Андрею
Dr. Andrey Remezov is conferred the academic degree of the candidate of medical sciences, specialty
хирургии.
surgery. Now I give you the floor
Владимировичу Ремезову
for your closing remarks.
изложение своей благодарности коллегам, с которыми
You can
руководитель.
talk for some time, you can express your thanks. I would like to thank the Dissertation Council for coming here at such a late hour. I would like to thank my research advisor for your support. I would like to thank my research advisor for your useful advice. And at one point, my research advisor motivated me to continue my research. I would like to thank you for pushing me in the right direction. It's very important to have such a leader. I would like to thank the others for coming here. I would like to thank my wife and my family. They have been supporting me. And my family had to bear the brunt of my worries, so thank you.
Процедуре еще последний вопрос.
My last question, dear colleagues,
Тем, что наше
I
заседание
have a question.
проводилось с участниками.
Some members of the Dissertation Council are attending the dissertation using a video conferencing system. Does anybody have a question or remarks about the procedure itself?
Александр Алексеевич,
Dr. Andreev, do you have remarks or objections? No objections. Dr. Sigua, Dr. Kashenka, I would like to congratulate you on getting the academic degree. Thank you very much. Please switch off the broadcast.